Okay, so the first concept that we really need to get when we're talking about where it is, it isn't, is that we have to understand that everything is completely connected. Via the fascial system, every nook and cranny of your body is connected from the very outer layers to the very innermost core dynamics of our structure, is that everything is completely connected. We're at a point right now where we're going from a world as flat to a world as round change in regards to how we understand how the body functions. 1700 century anatomists, really did an amazing job with starting our infancy into understanding what's happening with the body in regards to, okay, there's an origin, there's an insertion, we have the muscle that connects from A to B, and then the muscle does this motion. Well, what we're starting to understand now is that there's certain parts of muscles that actually are staying relaxed and soft when the same part or another part of the muscle, of the same muscle, is engaging. And so what that does and what that lets us know is that everything is completely connected. If I have a tent pole, an old-fashioned Boy Scout tent where I have the tent pole in the middle, and then the canopy that comes out from the side to the bottom, and then the cables that hold that to the ground, if I pull one of those cables just a little bit too hard, that takes the tent pole and changes it to a different direction, and then that addresses and changes what the whole structure is doing. Now, what we understand with the body, particularly in the world of structural integration, is that that's exactly what's happening when we're talking about pains versus symptoms, and then where the problem is versus what the patients are reporting. So what kind of benefits are we going to see as we start to understand where it is, it isn't? The biggest benefit is that you as a therapist, when you really understand where the problems are coming from the body, you're going to be able to make much quicker, faster changes with way less work. And if we think about it, massage therapy, a lot of people give us a hard time thinking, oh, we have such a soft, easy job. But as all of you guys know, once you start working on 5, 6, 7 patients a day, which most people don't, the average amount of patients a day a person is working on is 3 to 4, is that the more changes that we can get with less work, we're going to see way more improvements for our patients, and that's going to have a pretty significant impact on what's going on for the patients for the long term. So the greater benefit you can apply in a short time period kind of goes against the whole Western model. The Western model wants people to come again and again and again and again, and I've worked at some pretty big clinics throughout the country, and what we've seen is that certain doctors and certain practitioners can get frustrated if you get someone well and then you send them on their way, because they're looking for that residual income of the patient coming in very consistently. And that's not what we want to do. What we want, what our belief is in our clinic, is that if we can get a patient well, get them to understand what's going on in their body, they're going to be able to make long-term change, which allows them to stay well. And we're not going to lose any revenue from people getting better. We're actually going to see an increase in our revenue. So one of the other benefits to really understanding how to address problems versus symptoms is that the happier the patients are, the more patients they're going to refer to you. So you may not see that same patient every week for the rest of their lives, but you're going to make up for that in the amount of referrals that are coming in. Because when you can take a patient that's been dealing with long-term chronic pain and you can get them back to functioning at a higher level, they're going to be pretty happy and they're going to start sending a lot more people in. So again, we have people who've been dealing with these chronic pains, and how many of you guys and gals have had patients that they've literally done everything? They've done massage therapy, they've done chiropractic care, they've done physical therapy, they've exercised, they've worked with a trainer, they've got together with a dietitian, they've had the surgery, they've been on the medications, and they're still dealing with a very significant amount of pain. That's exactly what our clientele is in our office, and it's something that we've been working with for 12 years. So what is the client's part to where it is, it isn't? If we don't start with this next piece, which is the most important concept to the whole thing, the clients are never going to make any long-term change. And what the clients need to understand is that they have a very significant part in this process, is that what they're experiencing in their bodies in this very moment is exactly what they have created. Whether their bodies are overused, maybe they're triathletes and they're runners and they're putting on 100 miles a week. Maybe they play, you know, on 4 different softball teams. Maybe they have manufacturing jobs where they're working 70 to 80 hours a week and they're just overusing that body. That's a significant source of issues. The opposite of that is underuse. As we know, the majority of jobs in this country result in sedentary office work. We've seen such a huge transition of people being very active overall to now being very active in the big picture, especially in regards to sitting and watching TV. So people are spending 8, 9, 10 hours a day at their office, and they're going home, and on average in the States, they're watching between 5 to 6 hours of TV a night. So what happens is that that body starts deteriorating, and they put themselves in certain structural positions, and then the body starts to adapt to that. Some of the new findings that have been found with fascia very recently is that fascia is the connective tissue that essentially keeps our whole structure together. If you were to take the fascia out of the body, everything else would literally just fall apart. I like to compare it to a package of spaghetti noodles. I'm going to use pens here for this example. So if I have the spaghetti noodles should be able to slide in and out independently on their own accord. Now what happens is that each of those spaghetti noodles is layered in an element of fascia. Then that group of muscle cells or nerve bundle or bones or ligaments are encased in their own layer of fascia. And what happens is when that fascia becomes very sticky, as the muscle tries to slide, it gets stuck and it can't go anywhere. So then the next step to that is that as that piece gets glued to the layer above or below it, next thing you know, while this is trying to move, it's tugging on all of the neighbors and the body doesn't move very well. And again, this happens from being underused, overused, and or if we experience an injury, which is a lot of the patients that we're working with. Automobile accidents, cycling accidents, you know, there's, you know, all of you guys have great examples of some pretty weird ones out there too. Had a patient who recently just fell off a ladder and broke his back doing chores around the house. So there's a myriad of issues in which we're dealing with, but the two biggest, and I think where we see the most problem experientially in our clinic is people who are underutilizing their structure. What we know about a fascial cell is that it has to be under a certain amount of load. If it's not being used, the cell actually turns into a perfect sphere and then it starts to disintegrate. And so then that causes damage and scarring of the surrounding areas. Next thing you know, everything gets stuck together so the body doesn't have any kind of differentiated motion. And the difference between a structure that's pain-free and light and easy and is fun to live in is a body that has a lot of space and mobility between all of the layers. And if we don't have that, we start to see all sorts of issues. So the client has to really understand that what they're doing with their body on a daily basis is what's going to determine what is going on within their structure. And again, we can see this. I have patients who are seeing a chiropractor 3 times a week. They're getting 3 one-hour massages a week. They're going to a PT 3 times a week. So they're getting 9, 10 hours of therapy. So why are they not getting better? Again, there's something that's going on outside of the treatment sessions, and these practitioners are great. They're national level, they're world-renowned experts of what they do, but that patient is still having a hard time with chronic pain. So one of the things, the first step that I would encourage you to do in understanding where it isn't, is that we have to get our patients to acknowledge that there's something that they're doing in their lives that are causing those deviations and those gluing of the fascial layers. How are they sitting a certain way? Are they standing a certain way? Are they walking a certain way when they're at their job? Are they sitting in the computer all completely hunched over? There's so many examples, and we only have an hour tonight, so we're not going to get into all of them. But this is really the biggest piece. And what we found with the success that we have in our clinic is not the specific technique that I'm doing, so to say, is that it's the concept of once the patients start understanding what's going on, they can start to make the subtle changes to allow their body to come back to a more efficient state. An analogy, again, that I like, I love analogies, is that if I'm throwing rocks at a window and I break the window, but I just put up another window, but I'm still throwing the rocks, we're going to have issues for the rest of our lives. Maybe a person has had such a severe accident that they're not going to be able to stop throwing the rocks, but maybe we can change it from a brick, a big gigantic boulder, down to a little pebble that slows down or decreases how much pain they're in. As I'm sure you guys know, you work with patients who have pain, character-altering, debilitating pain. It ruins relationships. It separates people. It creates havoc in the household because someone is in so much physical pain that their mood, they're in severe depression, and the next thing you know, husband and wife stop connecting like they're supposed to. Relationships between parents and children, a mom or a dad can't go to the soccer game or can't go to the swim meet because they're in so much pain. So that really is a big piece, is understanding what's going on with your patients. So how do we get our patients to start doing the detective work at home? It's the simple things that make the most amount of change. For some of you, you're going to hear some of these concepts and say, well, of course I know that. Of course that's so simple. And if that's true, then that's fantastic, but why are our patients still having such a hard time? So we like to start with the basics, is that what are our patients doing consistently on a daily basis? Are they walking? Are they getting any kind of exercise, or are they sedentary? Are they sitting? If they have an active job, such as construction, or let's say they're a delivery person, they're a mechanic, they are very active, they are very busy, what things are they doing consistently? If we're working on a mechanic who's staring up at the undercarriage of a car, working on the bottom of an engine while the car is on the lift, what kinds of things are they doing there that are going to have a significant impact on that cervical vertebrae, on the low back? There's all sorts of things that are going on in that dynamic. So if we want the grass to be green, all we need to do is water it for 10 minutes a day, once a day, and we're going to have a nice green lush yard versus a yard that's starting to deteriorate. And the body's exactly that same way. So I would encourage you to go through with them in detail a consultation where you're asking them, what are your activities? What is your diet like? Now, it's out in the state of Washington, which is where we live, it's out of our scope of practice to advise on anything that pertains to the ingestion of any kind of a supplement or food. So when I ask them what they're doing with their diet, all that does for me is that gives me an idea. Are they deficient on calories? Are they excessive on calories? Maybe they're eating food, but they're not getting enough of the right nutrients for the body to repair itself. So once I have an idea of what they're doing or not doing with their body, I can send them to the right referral source. We can have them work with a dietitian who's going to be able to get them back on track. Maybe your client reports that they're having a really hard time in their marriage, or they're experiencing a lot of depression. And again, in most states, it's out of our scope of practice to counsel, but we can refer them to a mental health practitioner who's going to be able to help get them on track and help combine those tools together, where you can do the physical manipulation of the tissues and whatever it is that you do and your specialty is, and then the mental health practitioner can help work with their mental emotional state. And then when we see those things start changing, we're going to start to see a transition in chronic pain.